I'm Dr. Gallardo, and we're here about to perform a procedure. It's going to be a LANAP procedure plus removal of a third molar wisdom tooth and the placement of 2 implants, all under IV sedation. So let's get started. What we're going to do is start the IV. From the same IV, we're going to draw a few tubes of blood so that we can process proteins from her plasma. These proteins are going to help her heal faster. So let's get started with that. So the nice thing about the method that we're using is we can basically use a dial that allows us to draw blood from the same IV stick so that I don't have to stick her twice. So this is the mechanism here, basically connected to the catheter. And there we go. Today we're joined by our beautiful assistants, Lema and Levy. Without them, this wouldn't be possible. This is always a team approach that always leads to the best possible results. One of the things that we do with the plasma and the growth factors is we dip the implants, the dental implants, in them just seconds before placing them. Another thing that we do is after we've removed wisdom teeth, what we do today, we place the growth factors in the socket. The healing is accelerated, the discomfort is diminished dramatically, and we have in years not seen a dry socket, and we owe that to the growth factor proteins. Okay. Now what we'll do is we'll just simply attach. Remember, this is just one stick. It's already been accomplished. So now what we're going to do is we're going to attach the line, the IV line, to this end here, secure that, turn the dial, we remove the portal, we drew the blood, cap that, and we're done. We'll start the sedation process in just a few minutes, so we'll join each other again at the start of the procedure. Welcome back. Welcome back. This is Dr. Gallardo. We've sedated the patient, given the patient local anesthesia. I was just reviewing the CT scan, and the plan is to place 2 implants, remove a wisdom tooth, and do the LANAP procedure for periodontal disease. I'm planning on doing the actual implants using a very conservative approach, using a biopsy punch so that there's minimal invasiveness. So I can do that as long as I have a CT scan and I know and can anticipate the volume of bone that I have to work with. So let's go ahead and move towards the patient and we'll get started. Okay, so here we are using the biopsy punch. Just takes a few seconds to do it. Very simple. Okay. And now what we'll do is I like to remove these little plugs, but I want to save them just in case we need to do some plumping out of the tissue. Okay, there we go. So now we're ready to use our first drill. Use some irrigation. chair down a little bit. Okay, so we're using the pilot drill. And basically this is just the beginning of the opening. And the patient is sedated. So this is actually a non-event for the patient. Okay, so that's one side. Turn to the right. We're going to do the other premolar. Great news, very dense bone. So that's the second view. Same length. Just opening up the osteotomy a little bit. Will be the final drill to the shape of the implant. And here we're using no irrigation. And we're capturing some bone in case we need to use it. We do this routinely. And by using it, I mean using it over the implant and more invasive procedures. I still need to also going to use it on the left side. Don't worry about it. I won't. So we're going to now reshape the left side. Good. One is we're placing the fraction 3 growth factor proteins that we obtained from her plasma, and we're soaking the implant in it so that the surface is wet. And that's going to help us have a higher percentage of integration of bone cells to the surface of the implant, plus accelerated healing. Now we're going to go ahead and adjust and place. Yep. A lot of times what we'll do also is we'll go ahead and place the growth factors directly into the osteotomy. It really activates the biology. Good. And then now we'll go ahead and place the implant. Suction, please. Perfect. So that's one. Now we're going to go to the final implant. Pickups, please. Pickups. Pickups. Okay. There you go. Placing implant position number 5. Get too close, I can't. Sorry. Okay, so removing the pre-mounted solid abutments, and these will go ahead and reserve in the event that they'll be used for the final restoration. Otherwise, it could be a custom abutment. So we'll remove that one, and we'll remove the one on the left. Okay, so this is the healing abutment that's placed, and this allows the gingival tissues to form and heal around the implant. This makes it a one-stage implant, one step, no more surgeries. Okay, so we're ready for the second healing abutment. Perfect. Dr. John Paul Gallardo, and what we're going to be doing next is we're going to be removing a wisdom tooth, and we're going to be placing growth factors from the patient's own plasma, PRGF, and we're going to be placing it to avoid any dry sockets, to avoid any infections, and to create accelerated healing. Okay, so let's get started. This has been activated with calcium chloride. This is basically one of the fractions that's been spun out from her plasma. And we're just tucking it in. We're not using a bone graft because this is going to stimulate bone regeneration without the use of a bone graft. Okay. 4-0 chromic gut. I'm going to use the suture now. Estamos bien.
Abre grande, por favor. Abre grande. Sí, yo te voy a dar, déjame terminarte esta sutura. Te voy a dejar descansar. Muy bien. And then we'll just take out the gauze.
Hi, this is Dr. John Paul Gallardo, and I'm sitting here next to my sedated patient. What we're going to do today is we're going to basically do LANAP, L-A-N-A-P, laser-assisted new attachment procedure. This is the Millennium Perio Laser, and we're going to be using this. It's an ND-YAG laser, so that means that the light energy spectrum is going to be absorbed only in things that have pigment, and that would be bacteria, inflammation, and tartar. So we're going to use the first pass with the laser, which is a small fiber optic, it's going to go between the gum and the tooth, and it's going to basically be absorbed, the energy will be absorbed into anything that's disease-causing, okay? So we'll do that first, then we'll clean out everything that's been neutralized, and at the end we'll create a biologic seal using what we call a hemostasis setting, using the same laser. So the laser is going to basically detoxify, in other words, take care of the infection part, but it's also going to stimulate regeneration, which means regenerating the pocket depth and making sure that we go from a deep pocket to a shallower pocket can be maintained. In many cases, a year later, we actually see bone regeneration on the x-rays. It's a very exciting technology, and we're looking forward to getting started. All right, see you soon.
So this is basically the laser. This is the light energy. We're activating the tip up against the cotton roll. Okay, now we're ready to get started. It's about the size of 3 human hairs, this fiber optic. And basically what we're doing is just introducing it. This is a dental implant here, so we're using very light energy. This is another dental implant, very light energy, and then when we get to the actual natural tooth, then we just gently introduce it. And we let it interact with the tissue. If we turn the light off, just turn it away from the patient. So this is the LANAP. And this is just to demonstrate that the fiber optic is placed to the depth of the pocket. So you can see the radius of the tip and how much light energy is actually being expressed in all directions. So it is very thorough. It eliminates both bacteria that has invaded the tissue as well as bacteria that's on the surface of the root and basically floating around within the sulcus of the pocket.
Dr. John Paul Gallardo again. We've just completed the procedure. The procedure involved 2 dental implants using a conservative technique, using a biopsy punch instrument. We did 3rd molar removal, or wisdom tooth removal, placed PRGF, which is growth factors, into the socket for accelerated healing and to prevent a dry socket. And then we also did a full mouth of periodontal surgery using the LANAP technique. LANAP meaning laser-assisted knee attachment procedure. I'm very pleased with the results. From start to finish, the surgery, all of it, took only 2 hours. The patient wasn't aware of what was going on and had no sense of time. And again, the position of the implants were extremely satisfactory to me. And you can see that here on the x-rays. So not one suture was used for the periodontal surgery or for the implants, and a scalpel was not used whatsoever for any of the surgical appointment. Thank you.